So hello everyone, we are going to start a new series on this channel and we are going to talk about American politics.
US politics, Western politics, everything in between, focusing more on the developed economies. This is going to be the focus, but we'll veer into the Indian territory from time to time.
Okay, you might be wondering what makes us qualified to talk about American politics or left or right. Basically, we are from India, which is a completely normal, completely functioning society. We have no problems here, so we are going to talk about your problems.
And judge them.
Yeah.
You know, I think that's the main thing. So we not only talk about them, but we also judge them.
Yeah.
So we give them marks, we give them scores. So that is the purpose, and we believe that we are perfectly qualified to do so.
On a serious note, my brother is obsessed with Western policies, and yeah, you can see his name here.
So as Raj mentioned, this podcast is going to be focused on public policy, specifically public policy that has been implemented in Western countries. Our politics currently is divided along cultural lines, along religious lines. It is difficult to ascertain where we have a common ground. So the reason for doing this podcast is very simple, is to when we talk about politics in a country, nowadays it is too mired into individuals, into cult of personalities, into liking one politician versus disliking another politician, and that is not really healthy. So what this podcast does is it goes back to the basics of politics, and that is policy. What should matter in a democracy or a constitutional republic is the policy that is the vision of any ruling administration. So what we are going to do in this podcast is focus on various policies, substantive policies that affect everyday Indians, everyday citizens, and try to determine which policy, whether a right-wing policy or a left-wing policy, will advance our nation better. Now, to do so, it is not very healthy to look at a developing economy because we have not gone through the developmental process. So what we do here is we are going to look at the developed economies which have already implemented models, what they thought were at that time when they were a developing country, that will lead to better outcomes for the country. And we look at policies, social democratic policies, capitalistic politics, look at the results, facts, figures, and determine which is the best path forward empirically. Remember, this podcast will not talk about religious beliefs. It will not talk about any pseudoscience. It will only talk about facts, figures which can be verified, which can be vetted, and where we can find common ground on. It's policy over politics.
So Rohit, what is going to be the focus of this episode?
So this episode is predominantly going to focus on healthcare policy. So whenever you look at polling data of different developing countries or developed countries, one of the most significant issues that the citizenry of any country is concerned about in each poll is healthcare. Access to healthcare, expansion of healthcare, affordability, if they are in a remote areas, how to make it more accessible, how is government's performance on healthcare. So that it is one of the most substantive issues in politics today, and there is a fundamental debate between the right wing and the left wing on whether healthcare is a right or a privilege. I fundamentally believe that healthcare is a right and not a commodity. So what we are going to do in this episode is going to look at healthcare policy in developed economies, So we'll look at for benchmarking or for comparison, we are looking at two models. One is the US model, the other one is the European model. So looking at their performances, how they have fared over the years in terms of costs per person, in terms of outcomes, mortality rate, will determine which course in hindsight was the right one.
So why exactly you want to compare US and Europe, and why not Singapore or some other country?
The reason for that is Europe and US are both developed countries, so in that sense they are common. So they have matured markets, they have determined what their strengths and weaknesses are. Their average wealth is somewhere in the ballpark equal, and more importantly, they offer the starkest contrast in the sense US has decided to go on a libertarian, market-centered capitalist approach when it comes to healthcare. Europe has, on the other hand, taken a more socialist or social democratic way and adopted that kind of a model. So be it the Scandinavian model or the NHS model that is prevalent in UK. So there is stark contrast, there are commonalities, but in this one area they are very different. So they make excellent grounds for comparison.
So what are your views about current administration in the US and their policies?
What's your plan for Obamacare?
Obamacare is going to be repealed and replaced.
So how do you fix it?
There's many different ways, by the way. Everybody's got to be covered. This is an un-Republican thing for me to say.
Universal health care.
I am going to take care of everybody. I don't care if it costs me votes or not. Everybody's going to be taken care of much.
I think it's very obvious when you look at the facts. So forget about the personality, whether you like a politician, whether you like Trump, or whether you like the Republican Party, whether you like the Democratic Party, whether you like Barack Obama. If you take out the cult of personality aside, if you take out the tribalistic nature of our politics apart, and look at policies in isolation and the results in isolation, and apply objective parameters to assess performance, you will determine that the current administration has been bad. Now, why do I say that? Was Obama administration or the previous administration perfect? No. When Obama was in office, there were 30 million people in US which were uninsured. Now in India, that seems to be great. If we get 30 million people uninsured, that would be a miracle. But remember guys, US is the richest country in the history of the world. It is the richest country that ever existed. But still, they have 30 million of their people without health insurance.
That is like 10% of their population.
10% of their population, and for a developed economy, which is considered by any measure the leading country or the leading democratic and considered to be the beacon of democracy, it is a poor performance by any stretch of the imagination. So now specifically, so as I said, I will not talk about the views. Let's talk about the results. So why do I say that the current administration has been bad? Is in Trump's first year of office, the number of people that are uninsured have increased by 4 million. Okay, so what you have to understand is prior to 2010. US had a completely or rather more of a free healthcare, free market-based healthcare system. So they had some social programs for protection of vulnerable people. So they have Medicare. This is for people who are 65 years old and above. Okay. So that is a social program, that is a government aided healthcare system or a government aided medical insurance for older people.
Is there any policy for, say, poor people under the poverty line?
Yeah, so that is called Medicaid. So if you're falling below a certain threshold, there is a system called Medicaid, and what do you know? The most popular programs, insurance programs, are Medicare, which holds around 87%. So across the political spectrum, Republicans love it, Democratic loves it, Independents like it. Then Medicaid also fares very well, close to 70 to 75% every time. So both are in essence socialist programs in a capitalist country, and Americans when polled predominantly say that they are moderate or moderate conservative, but still they like a socialist system because the outcomes are something that is undisputable at this point of time. So that is the system. So they have Medicare for people who are older, they have Medicaid for poor people, and for everyone else it was more of a capitalist market-based system. So I have mine, so go yourself. So that was the situation. Now what happened was, that was not exactly true, because they have provision. So if you go to emergency room in US, you go to emergency room, you have a healthcare need, they have to provide that. So if you need a urgent operation, they have to do that. But preventive healthcare, those kinds of things are fallen by the wayside. So in 2010, what the previous administration tried to do was reform the system. So any reform would have been better. So a good healthcare reform will increase the number of people who are insured.
Are you talking about Obamacare?
Yeah. So what it did was it did not socialize healthcare. So it is completely a private system, but the government set up exchange. So it's like a stock exchange. So government has set up a stock exchange. You have several options. You go there, you select from a pool of options, and you take whichever health insurance company offers their exchanges in Obamacare in your state. You can select them. So what it did was it built competition. Because lot of people wanted to get health insurance, and since there was a portal and there were several options, people could choose from different private health insurance.
So did the price come down?
Price did not come down, but what happened was the rate of growth of the price. So every year the healthcare prices increase.
Okay.
So that has tempered down. So if the rate had grown like this, it grew like this. It did not solve the fundamental problem of. That is why we are trying to discuss at length on what has worked in Europe. But it put. The best analogy I tried to make, it put a band-aid on a gangrenous wound. Okay, but the number of people who are uninsured reduced from 20% to 10%. But so again, it was not the socialist system. It was the most market-centric system that was possible. So what they did was, so that they set up a health exchange, and people took it, and they levied some taxes on extremely wealthy people to subsidize the cost for other people. Then what they did was they put a lot of regulations in place, and which regulations are very, very popular. So one of the problems with healthcare prior to 2010 was insurers did not cover pre-existing conditions.
What does that mean?
Pre-existing conditions is something like, so if I have, for example, I have asthma, okay, and I want to get health insurance, the health insurer will not cover me because I have asthma, so they can deny me coverage. So what Obamacare did was they put a regulation that you have to cover pre-existing condition.
Okay.
So see, that doesn't make, so that is the fundamental debate. So if you believe that the healthcare is a commodity which is to be sold as a profit, then you will agree to that, agree to the framing that, okay, if you have pre-existing conditions, then you should be put on a higher risk pool and I will be losing money, so why should I cover you? But on the other hand, if you believe that yes, healthcare is a right, then yes, you will say, okay, this guy has a pre-existing condition, he needs healthcare the most. That means it's upon the government or a responsible citizenry to provide him the help that he needs. So that was the situation. So that was one thing. Second thing Obamacare change was, one of the most popular provisions was, if your parents have health insurance, till the age of 26 you can get health insurance from your parents. So you are covered under your parents' health insurance.
And how is this system different from Europe, say Scandinavian countries or UK?
Okay, so where it differs is, here it's still, although there are a set of regulations, it is still the private health insurance companies are involved. When it comes to Scandinavian model or the UK model, it's a single payer system. A single payer system or government running health insurance. So how does it work? So the government becomes the single buyer of health insurance. So you pay money in taxes to the government. The government does the bargaining for you. So the government purchases health insurance. So government becomes the health insurer. It will bargain with different private hospitals and healthcare providers to give you the best care that they possibly can. So what happens is, you have a pool with maximum volume, right? So when the government is provided, you are taxed. So it doesn't matter whether you have pre-existing condition or not, the government will cover you. It doesn't matter whether you have a job or not, the government will cover you. The private healthcare companies, while they are in the system, will someone deny the government, will not accept government as a customer? When you have 300 million people as customers, no one will let go of that business. So what it does is, it affords, because government is one entity with a large pool of people, it can bargain. So it gives the power back from the private companies to the citizens or the government, as it should be in the case of healthcare. Secondly, what it does is, it takes care of the pre-existing condition right away. So it establishes that healthcare is a right rather than a privilege. The third thing, what people forget or is not paid attention to in corporate media or anywhere else, is it is more efficient. So what you're doing is, the private health insurers are middleman. Okay, so they have a complete administrative setup with administrative employees. There are costs involved to maintain a middleman, which is not necessary. So it eliminates completely. So it brings simplicity. It is more, hence it becomes more effective. You are removing the profit motive. You are ensuring coverage, and then you get the best bargain, so that the citizenry gets the best care that they can at the best cost that it possibly can.
So thus far, which system has proven to be more successful? Do you have any numbers for that?
Yeah, so the numbers tell the story. It is convincing, it is one-sided, it proves beyond the point of doubt that healthcare cannot be governed as a commodity. It has to be considered a right. If you look at the results of the European model, the Scandinavian model, they are by far better. So let's look at the right-wing talking point first. So which is cheaper? Is it the private system governed by US, or the public system, or more socialized system which is prevalent in Europe? So overwhelmingly it is the socialized system or the Scandinavian system is much cheaper. On an average, when you look at the OECD countries, which are countries in the same which have economies comparable to US pays 2 times per capita than the average of these OECD countries, and the outcomes are not better. So US spends around $10,000 per person on healthcare, and the average of the other OECD countries is around 5,000. So US healthcare is twice as expensive. So you may think, okay, healthcare is expensive,
Maybe
but
the results are
good. So
maybe the life expectancy is better, or maybe the mortality rates are lower.
which is not true. So if you look at the figures, so let's look at life expectancy. As you can see in the chart, so these are the countries with the longest life expectancy. Japan, Switzerland, each of these, Singapore, all these countries have socialized healthcare or single payer system in one form or the other, and their life expectancy is about 80 years. US life expectancy is around 79 years, which is comparable to Costa Rica, right? So it does not.
I guess even China is catching on.
Yes, even China. We have taken it out of this comparison because it's still a developing nation, and it is very difficult to determine whether the outcomes or the results that they have are sustainable over a period of time. We are looking at countries which are
just for reference.
Yeah.
Even a developing country is catching up.
Correct. Let's look at health coverage. So when it comes to other nations, this is 100% coverage. So Australia has 100% coverage, Canada has 100% coverage, United States has 10% of its citizens which are not covered. And with the current administration, the action that they have taken to wreck Obamacare in principle, the uninsured rate has increased to 11% or 12%.
Obamacare is a disaster. I'm telling you, no matter where I went, people were suffering so badly with the ravages of Obamacare.
Let's look at the number of deaths per 100,000 people, which are considered to be preventable. So in that, when you look at that metric, US has 112 out of 100,000 preventable deaths. When you look at something like Sweden, it is exactly half. So it is around 56 preventable deaths out of 100,000 people. When it comes to France, it is around 60. So mortality rate is higher in US. Now let's look at number of hospital beds. So whether the access to healthcare. Access to healthcare. Let's compare. So per 1,000 beds, beds per 1,000 people, Japan leads in that. Korea, Germany. So all these countries, Switzerland, all these countries are ahead of United States. United States has around 2.8 beds per 2.8 beds per 1,000 patients. So access also is not higher when it comes to it. So in conclusion, if you look at the results, it is overwhelmingly clear. US healthcare is expensive. The system does not make healthcare more accessible to people. Lesser people are covered, and at the same time the mortality rates are higher
And life expectancy is lower.
So there is overwhelming trend. It costs more with with worse results. So it is definitely we can conclude based on these facts that the US healthcare system or the market-driven healthcare system is inferior objectively to a single-payer system or a socialized system which says that healthcare is a right rather than a privilege.
So just to round it up, how will you fix the system in US?
What I would do, I am of a belief that when it comes to public policy, I believe in empiricism or rationalism. That means if something has worked, we take that model and replicate it. So if US should look at a social democratic model like a Nordic model or a UK type model which has worked and which has better outcomes and implemented in the US. So what I would do, I would implement single payer system in US. So it is not only more cost efficient and it gives better results, but it is also politically more viable. Around 60% of Americans currently prefer Medicare for all. So you have a Medicare which is for 65 years and above. 60% of the populace agrees that it should be accessible to everyone. So that is one way you make a Medicare for all kind of a system. Other way is you can suppose you don't want to go for a Medicare for all system, you can put a public option in Obamacare. So to bring the cost down, you have a public option. So there is private health insurance, and you have one insurance that is provided by the government. So this keeps the cost in check. So the private insurance cannot jack up their price or their premiums very frequently. At the same time, for people who are not able to afford private health insurance, they can buy the public health insurance. So it increases access, so more people will be covered. It will also keep the private health insurance's costs and premiums down.
So one argument that people bring up that US has a big population, much more than say Scandinavian countries.
Yeah.
So can US afford to have such a system, a public model?
Yes, of course, because it doesn't matter how much population you have. It only matters what is the GDP per capita. So these countries whom we are comparing US with are in the same ballpark when it comes to GDP per capita. So unless you are a very poor nation, okay, which has a scarcity of resources, this model can work for everybody. So if you have enough wealth going around in a nation, all this policy asks is for a more equitable redistribution of the wealth. So let's look at US is already socialist in one manner. It has Medicare and Medicaid. It's all about expanding Medicare to everyone else. So it's not a radical shift in that direction. It's more about, okay, I have a private health insurance which is not working. I have a public health insurance system which is working because 87% people like it.
So basically extending
that to everyone else. So that would be a viable system. Politically now it is more viable. It is popular. And now there is a real push towards it with Bernie Sanders' campaign in 2016 that brought this in the 2016 primary against Hillary Clinton. This was one of the issues that he had highlighted in his platform, and he almost caught up to Hillary Clinton. Then very recently, Alexandria Ocasio-Cortez. She's a young Latina woman who unseated a 20-year-old veteran in the Democratic primary by adopting Medicare for all as part of her platform. So not only will it be politically expedient, it will also deliver results. And so if say for the Republican parties, for example, the Republican Party, their biggest voting base are seniors. So older people tend to vote Republican. So they love Medicare, right? So if you say that you are expanding Medicare, they will not have any problem. So they protect their base as well. 80% of the Democrats already support Medicare for all. So this would be a system which is politically viable, economically profitable, and it will be a moral thing to do.
I think the final takeaway from this video is that Americans are doing it wrong and we know better. We'll see you in the next episode with another policy to criticize, I guess.
Criticize or promote. I think what we are trying to do is look at systems that have worked versus what systems have not worked. What I would love to hear is your views on this. So I'm sure you will have useful inputs. So we would like to hear what are your inputs in the comments, and we will see you next time. Stay tuned.